On today's podcast, we are joined by the incomparable Dr. Mark Bieszka from Muskegon Surgical Associates. And today, it's time for your colonoscopy. We'll be talking about that and an EGD and why you might consider doing both at Muskegon Surgical Associates. As I said, our guest today, Dr. Mark Bieszka from Muskegon Surgical Associates. My dear friend, how are you today?
I'm not doing too bad. Not doing too bad. It's another day at the salt mines.
Absolutely. Your salt mines are a little bit nicer than most, though. And today we're obviously going to be talking about, as we were joking beforehand, both of the orifices, or one of those things, right? We'll be talking about both of those things. But before we talk about an EGD and a colonoscopy, I kind of want to get into your world, right? How did you get here? You're a general surgeon. You're not a specialist. So you do all sorts of things. Today we're focusing on one, but you do all sorts of things. And I'm wondering, what was that trajectory where you just thought, okay, generalist is what I'm going to do because of these reasons, as opposed to going and being that guy doing that thing?
Well, it started out when I was very young. My mother would have to go to all my teachers and tell them that I will be the worst student they will ever have unless they keep me occupied. And so she found out from a very young age that I'm all over the place. My mind is running a million miles an hour, and that you have to keep me interested and occupied. And the beauty of a general surgeon is, I get to do a little bit of everything. So I don't get bored. It doesn't just turn into this regular routine. Every person is a little bit different, and I get to treat every person specifically for what they need instead of just, like I said, getting into this boring routine.
Now, Mark, I'm speaking to you directly, so I'm not trying to paint as a broad brush, but I read this study about burnout in the medical profession, and I'm wondering about being a generalist, as you said, every day being different. Do you think that might help curtail some burnout, at least in your case?
Yes and no. I think of a lot of the burnout that physicians are feeling nowadays is because, we've, in some ways, as a medical society, we've lost control of medicine. We've given into the businessmen and the hospitals and the insurance companies. And, we have all these outside entities that are trying to dictate to us how to take care of a person when they have no clue who that individual is. They don't know Tom from Harry. They're not sitting in front of the person. They didn't spend 20 years getting educated on how to take care of someone, and so trying to fight the insurance companies, trying to fight the hospitals, trying to fight the bureaucratic mess that medicine has become is what really burns, physicians out. But yeah, for me, I mean, apart from dealing with all that, it keeps me interested doing just a little bit of everything.
So let's get a little bit more specific today. And there's two specific procedures we're going to talk about that can be done at MSA. And the first is a colonoscopy. And I'm wondering who falls into that bucket, when should we do it, and then why should we do it?
Yeah, no, that's a great question. So recently we actually started doing colonoscopies here in our office, talking about burnout.
Oh, wow.
Like you brought up. We've kind of gotten rid of the hospital, gotten rid of the insurance company, and said, hey, if you want a colonoscopy, we can do it here in our office for, like 5 times cheaper. A colonoscopy, if we do it here in our office for cash, is about $1,000 to $1,300, depending on what we need to do, as opposed to, going to the hospital and using your insurance. It's going to cost you about $5,000. And so it's significantly cheaper when we've cut out that bureaucratic nightmare and, are just focused on taking care of the patient. So colonoscopies we do here in the office, EGDs, which is sending a camera down in through your mouth, down into your stomach to look for, issues with, like, if you have bad heartburn or things like that, that can have, negative consequences for your tissues. And we need to monitor things and even fix things surgically. So, but back to colonoscopies in particular. The reason we do them is colon cancer is a very, very prevalent cancer in the entire human race. It's not just prevalent here. But the nice thing is colon cancer is very slow growing, And it typically starts as these tiny little millimeter-sized polyps that we can find on colonoscopy, remove them, and then you don't ever have to deal with them. As opposed to if you avoid the colonoscopy, you're now in your 60s, you start, pooping blood and things like that. And then we finally look, you've got this giant mass. Well, now you're going to end up with me doing a huge surgery, cutting tissues out. You'll need chemotherapy, things like that. But with a regular screening colonoscopy, we can prevent that from happening. We start at age 45 nowadays. Historically, we started at age 50, but now we're moving it down to 45 because we've learned that, we can find things quicker and earlier and prevent people from having, getting cancer.
And so, Dr. Bieszka, that also is the same for diverticulitis, right? You can notice that in a colonoscopy as well, or is that a totally different procedure?
Yeah. So diverticulitis is, I describe it to people like, think about a tire and how you can blow out the sidewall of a tire. Basically, diverticulosis, which is the disease, is like blowing out the sidewall of your colon. And so that's something that, we can see on colonoscopies. And really the treatment for that is just getting a good high fiber diet, eating those vegetables, eating the greens, eating the things that my food typically eats. It helps keep the stools nice and soft. So that way, you don't get it. But yeah, it's something we can see on colonoscopies and then, advise you on how to, manage your life in order to reduce the risk of having issues.
Awesome. So let's go to the other side of the body, and we'll go in through the throat, so to speak. And
Yes.
this EGD is a very complex word to actually say, so that's why most people use an EGD. But what is it? And again, when would I come see you? Is it just heartburn, or are there other factors that would have you and I having a meeting about it?
Yeah, no. So the EGD, it actually stands for esophagogastroduodenoscopy. And
Of course it
basically
does.
that's
Yes.
a really fancy word for I'm going to stick a camera in your mouth and look in your stomach. So heartburn is one of the big reasons. A lot of people have a lot of reflux. You'll take the antacid medicines over the counter. You can have long-term effects of that constant burning into your esophagus, which can actually cause cancer also. It's a rare cancer, but it can happen. And there's surgical fixes for that where I kind of wrap the stomach around your esophagus to create a nice valve in there to prevent it. But, we also have issues with people that, they just have like a chronic upper abdominal pain. There's the diagnosis of like celiac disease, which is, where people are intolerant to certain foods. And, we take biopsies and we can check for that in order to adjust your lifestyle in order to, be pain-free. Because ultimately that's what I want to do. I want to help people live their lives without having to worry about all of these other things. So really, anytime you're having this chronic upper abdominal pain, whether it's reflux, pain, nausea, bloating, in the EGD allows us to see if there's any structural causes for that.
So, Mark, and I know I'm not asking for you to give me a general prescription for how many times, but could you maybe put a little bit of framework around what chronic might be?
Oh, yeah. I mean, that's a good question. I would say if you've been dealing with something and take this with a grain of salt, like if your arm is flopped over sideways, it's a broken arm, go get it fixed. Don't wait for, a month. But, if you're having upper abdominal pain that's just kind of nagging at you and not going away, and it's been like, a few weeks to a month, that's kind of where I would start calling things chronic, and you may want to start getting it looked into.
All right. So you talked a little bit about one of the advantages is the cost coming down if you can pay cash and kind of bypass insurance. But if that's still an issue, do you guys do financing through MSA and how does that work?
Yeah. Yeah. So, well, for starters, so we don't just do cash in the office. We do also insurance patients in the office. Obviously, vast majority of people have insurance and can utilize that. But even people that have like high deductible insurances, it ends up being cheaper to pay it in cash and not even involve the insurance. But for those people that maybe don't have insurance or have insurance and want to avoid it, we do have financing plans. The organization that we use is Care Credit. And what they do is they allow you to finance whatever it is, let's say the $1,000 over a 12-month period at 0% interest. So, it takes that $1,000, which is it's still a lot of money. It's significantly cheaper than doing it at the hospital, but still a lot of money. And it allows you to finance it for, like I said, 0% interest over a 12-month period. So it makes it very palatable to people to be able to do.
Now, Dr. Bieszka, one of the things that we have not talked about yet today is one of the advantages of MSA is also, I mean, maybe you talked a little bit around it, but not directly to the intimacy, right? The office offers you some things that you wouldn't find at a hospital.
Yeah. So, when you go to the hospital, from the beginning, good luck finding parking, right?
Sure.
I mean, a nice thing, you come to our office, you park right by the front door, you walk in, you're met by Dee Dee or Tara or, one of the girls out front, and, you're an actual person. You're not just another number that they're trying to cycle through the salt mine. You're a person that's here to get taken care of. And so it's a very personal, intimate environment. You're not going to get lost because we're going to walk you everywhere you need to go. You're going to have someone by your side that cares about you as an individual and not just another means to an end.
Perfect. Dr. Mark Bieszka, if people want to reach out to Muskegon Surgical Associates, what's the best way for them to do that?
So you can call our office directly. So a lot of people think, oh, I need to have my primary care doctor refer me, or, I need X, Y, or Z. You can just call our office directly. And if we figure out ourselves that, well, yeah, you need a referral, we'll contact your primary care doctor. So if you need anything, whether it's, you need a colonoscopy, an EGD, you got skin lesions or bumps or breast cancer, or colon cancer, thyroid cancer, whatever it might be, gallbladders, your appendix, just call our office. And, we'll work in the background to figure out all the logistics of everything. But our number is the best way to get anything done.
Sounds perfect. Dr. Mark Bieszka, always a pleasure to talk to you. I'll let you get back to the actual important work and stop talking to me. We'll talk soon.
All right. Sounds great. Thanks.